Je suis libre parce qu'avant, c'était pas facile.
I think access to healthcare, ARVs, is all very disproportionate between adults and children. And we know that if children don't access life-saving ARVs, 50% of those children will die from AIDS-related disease within 5 years.
We define 10 priority intervention for the country, and all our partners, national and local, they have aligned to make sure they should be able to accompany us with this high-impact activity.
The work we do, especially in the Breakthrough Partnership, is a unique job because we are leveraging the skills of each partner.
At the start, it was difficult to understand the role. So each organization had to understand what kind of organization is EGPAF, what kind of organization is UNICEF, and how do we add the value, how do we see the value of each organization. And that makes the cooperation easier.
One of the most important things in the partnership is how we create platforms for dialogue.
We've always prioritised the Breakthrough Paediatric Partnership, as it's the only partnership of its kind where we have all 4 partners working in collaboration, and that makes it quite unique.
EGPAF has a lot of strength in basically medical mentorship, in really guiding into the details of each clinic, how can we improve the medical systems. PATA was more of an organization that's linked to the clinics, but it really values the link with the community. UNICEF functions at a very different levels. And with Aidsfonds, we basically look at which community organizations are already there. What do they do? Who do they know? They work close to the people that in any foreign organization can never replace or do. So the value of having the connections, having the understanding of how the community works, what they need, how they think, and still adding additional information, knowledge. So it's not just only collecting information and experience from the community, but also you add the new information and you learn from the different partners. So this really brings an added value for all partners.
One strength of the partnership is our focus on reaching the hard-to-reach areas. This is really where the key is, if we are to reach the last mile and leave no child behind.
I think all the partners bring expertises. We have that expertise in the community engagement, and we also have expertises in advocacy.
Et quand on parle de l'éradication du VIH de la mère à l'enfant, nous devons savoir que la communauté est au centre de la réponse. What we have noticed is that we cannot move in the HIV landscape without engaging faith-based institutions, because Cameroonians largely are influenced by their religion.
The community, they trust in their faith leader, the spiritual leader. We have a bigger role to play because the people trust us. Since the advent of the Breakthrough Partnership, we are more proactive in trying to get people to be tested.
And thanks to this effort, together with our international partners, we were able to move from 45% to 61% case finding for children who are living with HIV.
True long-term partnerships to me are those that adapt, deepen, and grow through uncertainty, driven not by duration alone, but by sustained relevance, trust, and co-ownership.
When we exchange experience, we learn from you, you learn from us.
We don't have to wait for the dream solution.
We have to work cohesively together.
We cannot stop.
Together we are stronger.